Some of my colleagues on the Democratic side who think we're on the 2-yard line, we're almost there. I don't think so. I think there are a number of problems that remain in this legislation that have got to be resolved, and I just want to touch on a few of them. Mr. President, one of the good parts of this legislation is finally we're going to add some 30 million Americans to insurance health care. That is a good thing. About half of those people are going to be added to an expanded Medicaid, a huge expansion of Medicaid. But here is my concern. Right now, our primary health care system is extremely weak. Everybody knows we don't have enough primary health care doctors. We know that Medicaid today is on wobbly legs as it tries to take care of the people who access that program. I am not quite sure how you add 15 million more people to Medicaid if you don't have a primary health care infrastructure to accommodate their needs. In this regard, I have fought very hard for authorization language in the Senate to greatly expand community health centers and the National Health Service Corps, which will train and make sure that we have the primary health care doctors, dentists, and nurses that we need, that we desperately need. In the House bill, there is language introduced by Representative Clyburn, supported by the Democratic leadership, that would provide $14 billion over a 5-year period to expand community health centers, enable tens of millions more to access health care, and make sure that we have the primary health care doctors and dentists that we need. Mr. President, it would be a cruel hoax to tell people that they now have health insurance, Medicaid or another program, but not create a situation by which they can get into the doctor's office. And I fear that may happen. So, Mr. President, I am going to fight as hard as I can to make sure that we have the primary health care infrastructure that we need. And that means here in the Senate adopting the language that currently exists in the House bill, $14 billion over a 5-year period, money which, according to a variety of studies, will pay for itself as we keep people out of the emergency room and as we keep people from getting sicker than they otherwise should and ending up in a hospital. This makes a lot of sense. Community health centers have had wide bipartisan support. We've got to support the House language. Now, Mr. President, on another issue, I found it interesting. My friend from Kansas a moment ago was denouncing the United Kingdom's health care system, denouncing socialized medicine, single payer. Well, I got a little bit confused by my Republican friends. They've been coming on the floor here day after day saying, we love Medicare. Oh, my word, do we love Medicare? We're really angry those Democrats trying to cut back on Medicare. We, Republicans, who year after year after year wanted to privatize Medicare, this week they love Medicare. Well, if they love it so much, why don't they join us in trying to expand Medicare and address some of the problems in Medicare? Let's work together. Last week, we were criticized, but now, well, I guess the tune has changed a little bit. Get your act together, my Republican friends. Either continue the line you've had for many years about detesting Medicare, because it is, in fact, a single-payer health care program, government health care program. That's what it is. It's a single-payer government health care program. You've been on the floor of the House defending it all week long until a couple of days ago. I support Medicare. In fact, what I believe and what I am fighting for is a Medicare for all single-payer program. Because at the end of the day, I disagree with many on this side of the aisle. I think at the end of the day, the only way you're going to provide comprehensive, universal health care to all Americans in a cost-effective manner is through a Medicare for all single-payer system, which ends the hundreds of billions of dollars in bureaucracy and waste engendered by the private insurance companies. Now, Mr. President, one of my concerns, as we seem to be hurtling down the finish line here, is I don't know who's going to be able to offer amendments. I have an amendment that speaks to what millions of Americans want, including the physicians for a national health care program. 17,000 doctors, mostly primary health care doctors, but not exclusively. They want to see this country have a Medicare for all single-payer system. I understand that I'm not going to get very many Republicans supporting that amendment. I'm not going to get any Republicans supporting that amendment. And I understand that I'm going to get few enough Democrats supporting that amendment. But at the end of the day, in years to come, we are going to have a Medicare for all single-payer system, and I want that debate on the floor of the Senate. I've offered an amendment, and I want the right to be able to have that debate. I don't need 20 hours. I don't need 5 days. I'd love to discuss with my Republican friends that issue, Democrats. That's an amendment that I think has a right to be offered and should be offered. Now, I understand that that amendment will not pass, but I'll tell you what could pass and what could have Republican support, and that is a provision that I've been working on, which at least says that in our federalist system, where each state learns from other states, at least gives states the option, if the governor wants, if the legislature wants, to go forward with a single-payer model. Maybe it works, maybe it doesn't work. But I have the feeling that if one state, whether it's Vermont, California, Pennsylvania, states that have strong single-payer movements, a lot of support for that concept, one state does it and does it well, other states around the country will be saying we want the same thing. It's the cost-effective way to provide comprehensive health care to all of our people. Mr. President, I want to touch on another issue where I think my colleagues here in the Senate are wrong and my colleagues, my former colleagues in the House, are right. And Mr. President, this is an issue that you have worked with me on. We just held a press conference this morning, and that is to understand that this legislation is going to cost between $800 billion and $1 trillion. How do you get the money? Well, the Senate bill contains a tax on health insurance benefits. I think that's wrong. I think that that is regressive. It's called a tax on Cadillac plans. Well, let me tell you, given the soaring cost of health care in America today, what may be a Cadillac plan today is going to be a junk car plan in 5 years from now. Millions of Americans are going to be forced to pay taxes on their health care benefits, or else their employer is going to cut back on those benefits, and they're going to have to pay for them out of their own pocket. That is wrong. It's a regressive and unfortunate and unfair way to raise the revenue that we need. Our friends in the House did the right thing. They said that millionaires should be asked to pay a little bit more in tax to make sure that we expand health care coverage in this country. And I support what our friends in the Senate, in the House did, and disagree with what is in the Senate bill. There'll be a poll coming out later this afternoon in which 70% of the American people, as I understand it, disagree with the tax on health care benefits. They understand that as a tax on the middle class. Let's be clear, we are in a terrible recession now. Working families are struggling. It is wrong for us to propose a tax on health care benefits, which in a few years will be impacting millions of middle-class workers. We should follow what the House has done and say to people at the top, millionaires who have received huge tax breaks under President Bush, they've got to pay a little bit more in taxes so that we can provide health care to all of our people. Mr. President, there is a lot in the bill in the Senate that makes a lot of sense to me. And I want to congratulate Senator Dodd and Senator Baucus and all those people and their staffs who have worked so very, very hard on this. We got 31 million more people who are going to get insurance. There's insurance company reform dealing with pre-existing conditions. We made some progress in disease prevention. We've made some progress in this bill. A lot of good things in it. But I want to be very clear. I do not think we are at the two-yard line. I think a lot of work has to be done to improve this bill. We need to, as I mentioned a moment ago, major improvements in primary health care. I think we need to change how we fund many parts of the expansion of insurance, do away with the tax on health care benefits. I think we have got to give states the option, the flexibility to go forward with a single-payer system if that is what they want to do. And I also hope very much that this afternoon we will vote and pass the reimportation prescription drug legislation championed by Senator Dorgan. It is an absurdity in this country that we remain the country that pays by far the highest prices in the world for prescription drugs. When I was in the House, I was the first member of Congress, as I understand it, to take Americans over the Canadian border. And back then, 10, 15 years ago, women were able to purchase the breast cancer drug tamoxifen for 1/10 the price that they were forced to pay in the United States. Now, I know the drug companies are very powerful. I know they have a lot of influence in this institution, but I hope that we can do the right thing and provide affordable medicine to all Americans through reimportation, and I hope that we can pass that bill. So, Mr. President, I did want to say that I have some very serious concerns about this legislation, and I hope that they will be addressed in the coming days and weeks. I very much want to be able to vote for this bill, but I am not there now, not by any means.